8 USMLE-style questions based on the topic of urease-positive organisms using the mnemonic P-chunk, Proteus, Cryptococcus, H. pylori, ureaplasma, nocardia, Klebsiella, S. epidermidis, S. saprophyticus. Each question includes correct answers, rationales, and explanations for why the other options are incorrect. Question 1. A 45-year-old man presents with recurrent UTIs. Urine culture reveals a urease-positive, gram-negative rod that swarms on agar. Which of the following complications is this patient most at risk for? A. Calcium oxalate stones. B. Uric acid stones. C. Struvite stones. D. Cysteine stones. E. Dehydration. Correct answer, Struvite stones. Explanation. Urease-positive organisms like Proteus hydrolyze urea, pH, risk for struvite magnesium ammonium phosphate stones. These are large staghorn calculi. Why not others? A. Calcium oxalate, most common but not linked to urease. B. Uric acid, forms an acidic urine, opposite of urease effect. D. Cysteine, genetic, not infection-related. E. Dehydration, nonspecific risk factor, not pathogen-specific. Question 2. A 30-year-old woman presents with burning micturition. Urinalysis reveals a urease-positive, gram-positive cocci in clusters. Which is the most likely organism? A. Enterococcus faecalis. B. Staphylococcus saprophyticus. C. Staphylococcus aureus. D. Escherichia coli. E. Streptococcus agalactiae. Correct answer, B. Staphylococcus saprophyticus. Explanation. Staph saprophyticus is urease-positive and a common cause of UTIs in young women. Why not others? A. Not urease-positive. C. Rare UTI pathogen, urease-negative. D. Common cause of UTI but urease-negative. E. GBS is urease-negative. Question 3. A patient with chronic gastritis undergoes a urea breath test that is positive. Which is the most likely pathogen? A. Escherichia coli. B. Campylobacter jejuni. C. Helicobacter pylori. D. Salmonella typhi. E. Vibrio cholera. Correct answer, C. Helicobacter pylori. H. pylori produces urease, converts urea, NH3 neutralizes stomach acid. Urea breath test detects this activity. Why not others? A, B, D, E, not urease positive or related to chronic gastritis. Question 4. Which urease-positive organism is most commonly associated with opportunistic meningitis in immunocompromised patients? A. Listeria monocytogenes. B. Cryptococcus neoformans. C. Mycobacterium tuberculosis. D. Neisseria meningitis. E. Streptococcus pneumonia. B. Cryptococcus. Explanation. C. Neoformans is a urease-positive encapsulated yeast seen in AIDS patients, detected with India ink or mucicarmine stain. Question 5. A culture of respiratory secretions from a patient with cavitary lung lesions grows a weakly acid-fast, branching, urease-positive organism. What is the most likely pathogen? A. Mycobacterium tuberculosis. B. Actinomyces israelii. C. Nocardia asteroides. D. Klebsiella pneumonia. E. Legionella pneumophila. Correct answer, C. Nocardia asteroides. Explanation. Nocardia is urease-positive, weakly acid-fast, and causes cavitary pulmonary disease in immunocompromised patients. Question 6. Which of the following best explains the pathogenesis of kidney stones in infections caused by urease-positive organisms? A. Urease converts ammonia to urea. B. Ammonia binds phosphate to lower pH. C. Urease increases ammonia, raises urinary pH, precipitates struvite. D. Urease forms oxalate salts. E. Ammonia decreases calcium absorption. Correct answer, C. Urease increases ammonia, raises urinary pH, precipitates struvite. Explanation. Urease hydrolyzes urea, ammonia plus CO2, urinary pH, precipitation of struvite stones. Question 7. Which of the following bacteria is urease positive and is a known cause of liver abscesses and pneumonia? A. Klebsiella pneumonia. B. Pseudomonas aeruginosa. C. Haemophilus influenzae. D. Streptococcus pneumonia. E. Mycoplasma pneumonia. Correct answer, A. Klebsiella pneumoniae. Explanation. Klebsiella is urease positive, encapsulated, and associated with pneumonia, current jelly sputum, and abscesses. Question 8. A urethral swab grows a urease positive organism lacking a cell wall. Which of the following antibiotics is most appropriate? A. Ceftriaxone. B. Vancomycin. D. Doxycycline. E. Amoxicillin. Correct answer, C. Doxycycline. Explanation. Ureaplasma lacks a cell wall, beta-lactams, penicillins, cephalosporins, vancomycin ineffective. Use tetracyclines, e.g. doxycycline or macrolides. Would you like a printable